established in 2006 by the Health Sector Reform Law.
Okay.
To improve the operations of health facilities and the quality of health at the health facilities.
Right. So 2006, that's more or less like 15 years now, if you to look through it. But under the themes agenda of Mr. Governor, where can we locate your agency?
The health and environment
component.
Yes.
Which is Pillar 2. Yes. Is that correct?
Very correct.
All right. So in these 2 years of Mr. Governor's administration, so how has it been for HEFAMAA?
Okay, so in the last 2 years, the agency has moved forward. We have been able to carry out our duties more effectively and efficiently. We recently moved to a facility that's office space.
Okay.
For the agency, so that we were able to accommodate the staff that was deployed to us, so that we were more effective in our duty. Yes, last year we closed about 124 facilities for not complying to the laid down standards of the agency, and the closure for some of these facilities were just temporary.
Okay.
We gave them the guidelines of what we expect of them, and then we encouraged and worked with them to improve the operations of the health facilities.
124. When you say 124, that tells me that we have a lot. So in terms of figures now, how many health facilities do we have in the state that are registered?
Oh, okay. So currently we have about 4,000 health facilities in different
One second,
categories.
let me see if I can take this call. Hello there, good morning. Hello? Okay. It's pretty bad. We'll try and see. The updates are trying to come in. All right, so you were saying we have how many facilities?
We have over 4,000.
4,000?
4,100, yes. But you know, the figure is not static, because as we register, we tend to close down, and then that means we have suspended, so to speak, the registration of that facility. And then we also have some health facilities that close down voluntarily.
Oh, okay.
By themselves.
By themselves?
Yes.
They were insolvent or something?
Sometimes.
Okay. So you have this kind of situation. All right. So what are the things? Let's break it down now. What are the kind of health facilities that you regulate, or perhaps you monitor and give accreditation?
So we have the various categories. We have hospitals, we have specialist hospitals, we have clinics, we have diagnostic centers, we have laboratories, we have...
What are pharmaceutical stores?
No.
You don't?
Yes. The pharmaceutical stores are not on.
They're not part of it?
Yes.
Okay.
Yes.
So all these ones you mentioned now, you know, my colleague was just, chatting with me earlier on before you came in, and he was asking questions. So who regulates those people that sell in bus stops and all those places?
We're not in charge of pharmaceutical services. The Directorate of Pharmaceutical Services in the Ministry of Health is in charge of pharmaceutical services in conjunction with the Pharmacists Council of Nigeria.
Right.
Yes, in Lagos State. But I would just say that those who hawk drugs are operating illegally, and the the Directorate of Pharmaceutical Services is working assiduously to put an end to that.
Yeah. All right, then Lagos Traffic Radio at 96.1 FM. Very shortly.
The first thing you do is to write a letter of intent to the Honorable Commissioner. Once you have done that, we, of course, as the agency, we get in touch with you, and we ask you to go online to do your registration. We have a portal, a registration portal on our website, hefama.lagostate.gov.ng.
Okay.
You register on that portal and you upload relevant documents. And once you have done that, we review those documents that you uploaded at the back end, and then we go for an inspection. Once we have done the inspection and we are satisfied that you meet the minimum required standards, we issue a certificate of registration.
So how do I know that the facility that I'm using is registered with you guys?
Okay, so the first thing we ask the proprietors and the operating officers to do once you are registered is to paste a copy of the certificate of registration at the reception, and then even from the outside you have a logo, what we call an identification logo
that shows
showing,
HEFAMAA.
yes, showing HEFAMAA, the schedule that we have registered you for, and of course your number, your registration number with us.
Total compliance?
Yes, the agency currently has 5 monitoring teams for the Abiola division of Lagos State, and the team goes out every day on monitoring. We have a schedule already to the different areas, and then of course sometimes we get petitions, or we get people asking us to look at one facility or the other. So outside of our schedule, we also visit those facilities that have petitions or things like that.
Right. Okay then. So what do I stand to lose if my facility is not registered?
Okay, a facility that is not registered is operating illegally.
Okay.
According to the health sector reform law, before you operate any health facility, you have to register it. So you stand to be prosecuted and the facility shut down.
Right. Okay. So what are the penalties?
Okay. So what once you are prosecuted, you are given a fine, or we shut the facility down.
Ah.
Yeah.
All right. All right. So when
on a yearly basis, so you need to renew on a yearly basis, and we do that so that once we have registered you, we can confirm on a yearly basis that you are complying with the standards at which we give you
a single registration, would that cover for me?
We register health facilities by location, so one certificate cannot cover.
It can't cover for the two?
Yes.
So I have to get 2 separate registrations?
Yes, you have to get 2 separate registrations for our job as regulators. The COVID-19 has slowed down the activities of the providers, but during the heat of the COVID-19, the agency carried out some strategies to ensure that the health facilities could still practice and not get the health workers down with COVID-19. So we went to the health facilities for sensitization. We sensitized the health facilities on the need to triage their patients, on the need to have holding bay, so that if the patient is suspected to have COVID-19, the patient will be kept in the holding bay before they are transferred to the isolation centers. Then we also sensitize them on infection prevention control to ensure that the health workers don't come down themselves with
COVID-19. Right.
To ensure they didn't. And then we also distributed educational materials both on infection prevention control and COVID-19.
Right. So all this has been going on.
Yes.
And you did say that your monitoring team, you're always there through the 5 divisions of the state.
Yes.
So you mean you have monitoring squads in place?
The number one thing is for you to tell us that's your intention. You give us that intention through the Honorable Commissioner. And then once you go on our website, we tell you go on the website. On the website, there is a page for the requirements. For example, we want to know you are living in Lagos State. You are a resident. We would ask for your LASRA registration. We want to know that you are paying your tax. So we also ask for your evidence of your income tax. We want to know that you have qualified persons who will be working in that facility. So we request for their certificates and then their licenses. We also request even before we go to that facility, we request for the layout of the facility, just to ensure that the layout is in keeping with the public health requirements. And then we ask for how to get to the facility. depending on how quick you can upload all the documents. But our charter is that once you are able to upload all the documents, that would visit you within 6 weeks and give you a license.
Right.
5 monitoring teams. So that in itself is inadequate for the whole of Lagos State. So
you're looking for a way
yes.
of getting more.
Yeah.
Okay.
So, and then of course we need monitoring vehicles so that we're able to.
Let me see if I can take this call. Last ma'am, hello there. Good morning. Good morning.
Morning. I bet why go to Abapa now? Why the governor? You don't give a lot of your Papa Borut. How can I decide to take Abapa now?
Okay, what's your name?
Abapa.
What is your name, sir? Hello, sir. What is your name? Okay, all right. I guess we're having a breakdown in communication there. All right. He appears to be complaining about our Papa this morning. Of course, I will look into that. So let's begin to take this home this morning, madam. You've said a lot about what you do, the challenges confronting you. What are your expectations, really, of these health institutions within the state, and what advice would you give them as they continue to, perform their roles and their duties?
Okay, so you were asking for some of our achievements. One of our key achievements is that we've been able to improve our engagement with the professional associations.
Okay.
So in doing that, we are hoping that in improving our engagement with the professional associations, we're able to improve our engagement with the private providers, and we are able to communicate adequately to them what we expect of them in terms of the standards.
All right.
In terms of agreeing to the standards that we expect of them. And then, of course, for the professional associations to work with the private healthcare providers,
right,
to kind of regulate them,
So that engagement has improved greatly.
Yes.
All right.
Has improved.
So your message to people, even as we depart the program?
Okay. So we're asking the public that they should please patronize only health facilities that are registered with HEFAMAA, only health facilities that have the HEFAMAA logo.
Okay.
That is, and then we also want to employ them that if they think that they have gone to a health facility in Lagos and they need to complain,
right? Complain,
or they want improvement in the services that they have,
they can call you.
Yes.
Is there any number that they can call? Or
yes.
any email? Quickly.
Okay, so they can tweet us on at HEFAMAA, and then we also have Instagram.
Right.
Yes, it's also, I think it's also at HEFAMAA.
At HEFAMAA.
Yes, and then they can send us emails, hefama@lagostate.gov.ng. And then also our website is interactive.
All right.
Yes.
Okay.
And we have numbers on our website that they can call.
All
and
right.
they can also leave messages on the website. And we promise to get back to them within 24 hours.
All right, then. So we'll leave it at that for now. Dr. Idowu Abiola, it's nice having you in the studios this morning. Even though it was a little bit behind schedule, but of course, we'll be able to get through what you guys are doing and the achievements of Mr. Governor in 2 years. Thank you so much for being here.
Okay, thank you so much, Victor.
Thank
you for having me.
Great, and maximum thanks to Uthman, who's the public relations, public affairs officer for HEFAMAA. He's been doing a whole lot of job behind the scenes to ensure that we get this program on. Corey Debamishile has produced the program this morning. Mubosola Kasalis of our ICT unit, and maximum thanks to Tayo Akonle, our executive producer. Tomorrow, your side mirror will return, but till then, this is Victor Terry. Have a great day. Bye for now.
Chatting while driving is not multitasking. It is driving blind. Drive